Dr. Burhenne here of AskTheDentist.com with a new member of the family, Quinn, my first granddaughter. And we're talking about tips for raising a baby with great teeth and mouth and bone structure. I mean, those are all really important things. In other words, if Quinn can develop correctly and fully, then she won't have sleep apnea later on in her life, for example. So here's some tips. You want your toothbrush? Here's some tips. Breastfeeding. Breastfeeding is key. I know that puts a lot of pressure on mom, but do everything you can possibly to allow your child to breastfeed, at least for a year if possible. The latching on mechanism, in a nutshell, it's the muscles that form the jawbone and the lower face. So if the baby is sucking properly on mother's breast, then you're going to get all of that. So check for a tongue tie. That's very, very important. If there's a tongue tie, that won't happen. The breastfeeding will be very difficult. Be very judicious with pacifiers. There goes the toothbrush. Be very judicious with pacifiers. I'm not going to tell you not to use them, but hold off as long as you can, and don't just instantly give them a computer or a pacifier at any given time, because they'll just get used to it and they'll rely on it. So be very judicious with that. Avoid some of these teething remedies like the benzocaine and these numbing gels, and be very careful. Those are chemicals. Your baby's going to ingest anything you put in their mouth. That's just a fact, like fluoridated toothpaste, and that's not a good thing for your baby. So making the first dental appointment, certainly when the teeth are coming in, that's important, but I would actually bring them in at your normally scheduled dental visit. So if you have a dental visit 3 months after your baby's born, bring them in. They'll eventually get used to the whole process of that sterile white room and the guy with the white jacket, the gal with the white jacket, the dental hygienist. And but the important thing is that they're seeing the parent, mom or dad, getting their teeth clean. It takes 45 minutes, that kind of thing. That's important. So always avoid sending your baby to bed with a bottle. That is probably the biggest cause of cavities at this age, and they're difficult to fix, and it's very traumatic for your child to have that done. And you may have to anesthetize your child with general anesthesia to get the job done, and that's a really difficult thing to see as a parent. And then, of course, brushing. Learn how to brush. We have a video on that where I show Quinn being introduced to a toothbrush. Stay away from toothpaste. Keep it simple. Small toothbrush. She really wants this computer. Those are some tips on providing a good introduction to oral health for your child. One last thing I want to add is cod liver oil. Get your child used to sipping out of a spoon some cod liver oil. That alone can help the development of the child's face and also teeth. It will make the teeth stronger and less likely to get cavities later on. So that simple little thing you can do early on will save you a lot later. And I'm not talking about just the expenses of fillings. It's the trauma of seeing your child have to go through all that at age 4 or 5 or 6. So anyway, I certainly hope that doesn't happen to Quinn. We're working on all of these tips, and she is our guinea pig on all this. So anyway, thanks for watching. Thanks for listening to this video, and if you have any questions about what to do with your kids, please let us know in the comments below, and I'm happy to look at them and answer them. Thanks for watching this video, and we'll see you in the next one. Thanks.